Good afternoon. I'm Dr. Stephen May, Medical Director of the Sullivan County Regional Health Department, and I wanted to welcome you here and thank you for participating in this press release today. With me today, we have Mayor Venable, Mayor Shull, Major Luttrell, Jim Bean, our EMA Director, and our Health Department Director, Gary Mays. And we want to thank you, our news partners, for being here to help us share this message. First, I'll start out with the state of disease and what is our current status here in Sullivan County. In Sullivan County today, we anticipate that we'll be exceeding over 200 cases of COVID-19 within our community. We are now dealing with clusters within some of our healthcare facilities within our communities. We are also concerned over hospital capacity and our ability to deal with disease in our region. Unfortunately, overnight, we've had 2 unfortunate deaths in our community for which we mourn due to COVID-19 disease. So it stresses the importance of what are the mitigating factors that we can do to prevent the spread of this disease. First, social distancing, maintaining 6 feet between each other prevents the spread of this disease. Frequent hand washing, we've been talking about for some time. At this time, too, it's also, we encourage any unnecessary travel. And if you must travel, practice safe, universal safety practices. And finally, masking. We know masking makes a difference in preventing the spread of this disease. Remember, your mask protects your neighbor. Their mask protects you. So with this, we want to remember all these mitigating factors, things that we can do to take care of each other. And so at this time, I want to go ahead and turn it over to Mayor Venable for this proclamation. Thank you.
Thank you, Dr. May. And thank you all for coming on what our Director, Gary May, mentioned is a historical day, and we've had a lot of those in Sullivan County lately. This morning, after conferring with my colleagues in Bristol, Bluff City, and Kingsport, and conferring with Dr. May and Gary Mays on our status, which the doctor has just reviewed with you, we jointly determined that it's in the best interest of the people of Sullivan County that I issue the following order. Sullivan County Executive Order 1. I'll read it for you and then we'll be happy to take questions. Whereas a novel coronavirus, which causes the disease COVID-19, has spread through the world and has now been declared a global pandemic by the World Health Organization. Whereas on March 12, 2020, Tennessee Governor Bill Lee declared a state of emergency to deploy additional resources to combat the spread of the virus. And on March 13, 2020, President Donald Trump declared a national emergency over the coronavirus pandemic. Whereas Governor Lee has issued Executive Orders number 38 and 50, which, among other things, provides instructions for the operation of businesses during COVID-19 global pandemic. Now, therefore, I, Richard Venable, Mayor, pursuant to State of Tennessee Executive Order number 54 and the laws of the State of Tennessee, execute the following. Number 1, effective at 12:01 a.m. on July 12, 2020, all businesses, organizations, and venues open to usage by members of the public in Sullivan County, Tennessee, shall require the use of face coverings or masks by their employees and members of the public while inside the premises in areas accessible to the public. One note to item number 1. Cloth face coverings or masks should not be worn by children under 2 or anyone who has trouble breathing, is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Item number 2, places of worship are exempt from the requirements of this order pursuant to the Governor Lee's Executive Order number 38 and 50. Number 3, The order does not require businesses, organizations, or venues to supply face coverings or masks to the public. Number 4, use of face coverings or masks shall not be required by members of the public while seated for the purpose of dining in any restaurant or business that provides food and or drink for on-premise consumption or other businesses defined by the Tennessee Pledge. Number 5, Sullivan County, Tennessee continues to be governed by all other aspects by the executive orders issued by Governor Lee. And finally, number 6, this order shall remain in effect until 11:59 on August 12, 2020, unless otherwise modified or withdrawn by future orders or by the state of Tennessee. Issued this 10th day of July 2020, Richard Venable, Mayor of Sullivan County. Having said that and issued this order, I want to say that I'm proud of the discipline that our people in Sullivan County have exhibited throughout this part of our history. But the events of the last week, with over 80 new cases and nearly doubling the cases of COVID-19 in Sullivan County, doubling our people in the hospital, and the additional deaths that we have experienced, we find it necessary for government to take this action. I think Ben Franklin said those who sacrifice their liberty in the pursuit of security have neither. I would say that that's not the case in this case. We're asking people for cooperation and for them to experience possibly what they might think a minor inconvenience, as Dr. May said, for their neighbors. I have personal experience that I thought I had COVID, and there's no worse feeling that I've had thinking that you might have passed that on to your family members and your colleagues. I would urge all the folks who are going on vacation or who have gone on vacation, when they return, to limit their behavior until they understand and are satisfied that they are not infectious. I personally think this spike this week is related to vacations and people not being careful. So I urge people, I'm not saying don't go on vacation. I urge you to go to places that aren't hot spots, and that when you return that you give yourself sufficient time and your family before you visit your grandparents or your uncles or your aunts or your brothers or your sisters to make sure you're not infectious. So at this time, I would like to recognize my colleagues. Mayor Wells is not with us today, but she was with us this morning when we had our joint meeting by Zoom, and I'd like at this time to recognize Bristol Mayor Luttrell. Malin?
Thank you, Richard. You know, decisions like this are not taken very lightly. You know, a lot of thought goes into this. You know, if this action can save one life, it's well worth it. If this action can allow our children to attend and go to school on time as scheduled, it's worth it. And if you look around, you know, just the folks in this room, look at each other. I mean, you're very important as well. And, you know, these are hard times. And, you know, there's going to be some folks that's not going to be happy about this, but that's okay. But these are the right decisions to be made. Thank you.
Mayor Pat Shaw.
Good afternoon. I'm Pat Shaw. I'm mayor of Kingsport. And I love Kingsport and all its citizens. And that's why I'm fully supportive of this action. I think it's well reasoned. It's very carefully thought through, and it's the right thing to do. It does not unduly restrict activity, but it does put people in a position where they can stay safe and they can preserve the health of not only themselves, but their friends, colleagues, neighbors, family, and it's just the right thing to do. So I applaud the Sullivan County Health Department for assisting Mayor Venable in putting this together and taking input from both Bristol and Kingsport, and we can get through this together. Thank you.
Thanks, Pat. Well, at this point, we don't have any other prepared remarks, and we'll be happy to take any questions if you might have. And I know Gary and Dr. May would also want to address the more technical points. Yes, sir.
Judge Hennis, Bristol Herald-Courier. How will this affect upcoming activities at Bristol Motor Speedway?
How will it affect?
Upcoming activities at Bristol Motor Speedway?
I don't think it will. I hope it will affect the spread of the disease. You want to come on up to here? Obviously, we want to slow and stop the spread of the disease. I don't think it's going to negatively impact the activities at the racetrack. I don't think anybody's ever questioned the protocol that BMS has installed, that inside the racetrack we're going to be fine. We're trying to deal with outside. We're trying to tell our visitors that please protect our food service people. Please protect our people who work in hotels. Cooperate with us. As I say, you're not giving up liberty. You're only showing respect for your other people. So answer the question. I don't think it will affect it.
And one last question, just to keep up to date. How many deaths have we had in Sullivan County from the coronavirus COVID-19?
I believe reported officially, they're telling me 4. We had 2 this morning, if I understand. Had 2 additional. So that's a tragic event. I believe there were 22 additional cases today, Gary, that were reported, and that would give us during this week nearly 100 additional cases.
And why did you choose August 12th as the expiration date?
The 30-day limit gives us an opportunity to examine and see what effect we've had. If it's been good, I think school will have started by then. If we can drive our numbers lower, on August 3rd, our schools are 5th in the county. Our schools are slated to open. Our numbers right now are bordering on the limit of whether they can open the normal school year or whether they're going to be pushed into the next category. We will hope to give them as normal a situation as we can to open schools. This is about that as much as anything else.
And how will this be enforced, Mayor Venable?
I'm sorry?
How will this be enforced?
It will be, there will be no formal enforcement of this act. I know other areas have put teeth in it, and my honest opinion is I don't have, as mayor of Sullivan County, Tennessee, the ability to make law, and I don't think anybody other than the legislature can give me that ability.
So
They have not bestowed that on me yet.
if someone sees a business not complying or something of that nature, how can they let you know or let the health department know to be sure that everyone is compliant?
I would exercise my choice and my prerogative not to eat in that establishment. But as far as a number to call, Gary, we don't have anything set up for the number of calls that we would get. I can tell you, we will have literally thousands of calls. But I would, as I said before in a public way, I don't. One of the things that's kept me from doing this is the public shaming, the vigilante groups that could form. I don't want that, and I don't think the public wants that. I think it's not unusual to offer somebody a mask if they don't have one. And let me say that, if they'll contact us, if they can't get a mask, if they can't afford a mask, if they'll contact us, we'll have some mask at our health department. So we won't have enough for the entire population, but as you know, businesses are putting their registered trademarks on these masks, and it's becoming quite a collection item. So if people will look around, hopefully they'll be able to find masks.
Dr. May, are you available for questions?
Yes, ma'am. Really quick, Mayor, while you're up there, was there any discussion about implementing this sooner, the mask mandate?
Well, in my own mind, I'd like to have implemented it in January, but no. We have systematically reviewed, Jarvis, we've systematically reviewed this at least once a week and probably 3 times a week with our colleagues in Nashville, Commissioner Zell. It's under constant review. We have not, as you know, when looking at the records, had double-digit increases, but I believe one time in the last 3 or 4 months. And only this week have we seen those double-digit increases. and the doubling and doubling and doubling. And so I think it's timely. I hate that people have it, but you got to remember, this is not something government can bestow on you. It's still your personal responsibility to wash your hands and to wear the mask and maintain social distancing. Government can't do that for you, and shouldn't do that for you. So I believe we have a question for Dr. May.
I have a couple questions for you. Dr. May, obviously this morning we found out that several deaths came out of a nursing home situation in Bristol. Can you elaborate on those at all and what you're doing here in the nursing homes to stop that from happening now that numbers are rising?
Well, back at the advent of this, working through CMS, working with the Tennessee Department of Health, a number of regulations, guidelines, and initiatives were implemented throughout all nursing homes throughout the state of Tennessee. And they have done a great job in trying to get these implemented within each facility. Unfortunately, once it gets into a facility, it tends to be rapidly spreading, and control measures are in place. We are in touch with each facility on a daily basis, working on case counts, looking at their testing methodologies, their testing results, and we work very closely with them.
And next question for you. According to the state website, our region, including Sullivan County, has the lowest testing rate for the state per 100,000 residents. Why is testing so low, and does that mean we could potentially have more cases here than what we realize?
Well, that is absolutely true, and we look to try to keep our positivity rate around 5%. That tells us that we're doing enough testing. Right now, our positivity rate is close to 8% across the state. In the past, there's not been quite as much interest, I think, with the public due to the very, very low rates of disease we've been fortunate to experience. However, we see the interest in getting tested increasing among our population, and we are making that testing available through multiple outlets.
And earlier you mentioned there are several healthcare clusters that you guys have recognized. Can you elaborate on that a little bit?
Well, we're dealing with 2 nursing homes right now, and then a couple of other businesses that have had clusters. We investigate each one of those, and we provide education and instruction and guidance in each one of those, trying to work through that with our contact investigation team.
And another question about schools, last one. Obviously, school is expected to start sometime soon, and do you expect kids to be able to safely go back to school with the case numbers rising like this?
We'll have to see where the case numbers go and where they take us. We do have published guidelines on what levels of safety measures will be implemented based upon the case rate within Sullivan County.
Are you seeing a delay in turnarounds to get results back, or are they still coming in pretty regularly?
The average time is usually 2 to 3 days, but each lab, depending on their caseload and basically by day, it depends on the rapid turnaround that we hope to get. Most labs are turning them around within 2 days, although some labs can be as high as 5 days depending on the caseload that they have.
And when someone's being tested, are they still being told to go home and self-quarantine until their results come back?
Absolutely. They should be self-quarantined until we get that negative result back. Or if they continue to be ill, we don't want anyone with any illness out running around in public. So we want them feeling well, even with a negative test result.
And earlier with those clusters, you mentioned businesses. What are your enforcements for that? Do businesses need to be closing down if they have a cluster of employees? Or
that depends on each case investigation that we do and what were the circumstances of transmission. Yes, sir.
For identification purposes, will you spell your first and last name and give me your title and your position?
Yes, sir. I'm Dr. Andrew Stephen May. I am the Regional Medical Director at Sullivan County Regional Health Department. M-A-Y. M-A-Y. A-N-D-R-E-W-S-T-E-P-H-E-N-M-A-Y.
Okay. Are you concerned from a medical standpoint, when is all this going to end? And is it going to get worse in the fall as predictions are coming?
I'm concerned about the fall, particularly when we get the intermixing of viruses, particularly with the flu virus, the other viruses that co-circulate during the respiratory season. Fortunately, the same measures that we use for control of coronavirus also, I'm hoping, will reduce the incidence of some of those diseases as we get back into fall. But that is a major concern as we get into it, the intermixing of multiple viruses at the same time, particularly in the aspect of rapid diagnosis.
And before we wrap up, if there is anything you can stress to the public right now with the rising case numbers and overnight deaths and things of that nature, what would you stress to them right this moment?
Right now, I'd stress that complacency is our biggest enemy. We know what works. We know what's effective. That's been tried and true. And now is the time we need to start practicing this to try to decrease the rate of our increase in the number of cases.
So this would include, for example, in Bristol, the skating rink. Anybody that goes to the skating rink needs to have a mask or something like this. Is that correct?
Well, anyone who is within 6 feet of another person should consider wearing a mask.